So options for denture wearers. So if a denture wearer goes into, they're wearing false teeth, they go to your office, what's that process like? What are their options when it comes to dental implants in your office?
Well, when somebody already has dentures, typically they're coming in because they want to be more stable. Dentures typically fit, like I say, socks on a rooster. They just don't fit well. They move all over the place. That's why people don't like them.
Okay.
So implants can help stabilize the dentures. The first option, which would probably be the simplest, is we place 2 implants in the bottom jaw. When those implants are in, the denture still snaps into place. Now, just because those implants are there does not mean that the denture is not going to move. Those implants basically keep the denture from coming out of the mouth.
Okay.
You could still get food and debris up underneath the denture, and that's a common misconception people have just because they have an implant
But it's
denture.
better than a loose-fitting denture.
Totally, completely.
Okay.
Now, some offices will do implants for the top dentures, and they have a snap-in top denture, but those we tend to see higher failure rates with. That's also borne out in the dental literature. Also, you still have a denture that's covering the roof of the mouth. So some offices will do dental implants for the top dentures, where you have a denture that snaps into the implants up top. But there's a number of problems with those. One, dental literature has shown that those tend to have higher failure rates over time. 2, you still have a denture that's covering the roof of your mouth. So it eliminates the taste because you have your tongue that's still feeling all that plastic on the roof of your mouth.
Okay.
You still get food and debris up underneath there. You are still having some mobility of that denture. You're still having to take the denture out every night.
Okay.
And also with snap-in dentures, you have maintenance on those. You have gaskets that have to be changed out every 3 months to keep those dentures fitting tightly onto those implants. So you still have costs over time. You still have to take the dentures out at night, put them into a glass.
I'm picking up on the fact that you're not a big fan of the snap-in, snap-out.
I am not
dentures.
a big fan. Now, compared to having nothing done, it's certainly a step up. I usually never do any snap-ins up on the top because we see so many problems with them. So what we like to do in our office is to give dental implants and teeth that are permanent. They do not come out of the mouth. They are not implant dentures. They are permanent fixed bridges that we put the implants in, and on the same day we can attach the teeth, where even if you have snap-in dentures, you can't do that. You still have to let those implants heal for 3 months. So while those implants are healing, you have to wear these dentures that are flopping all over your mouth before you can snap them in. With our teeth in a day type of option where we're placing implants, we are attaching those teeth to the implants on the same day. They are permanent. They don't come out of the mouth. You can eat whatever you want with those. But with snap-in dentures, you can't generate as much chewing force as you can with the permanent implant bridges. So even though you have implants, you still have to avoid certain foods.
So snap-in, snap-out, you can't eat very well.
You can eat better than a regular denture, but you certainly can't generate the chewing force that you can generate with permanent fixed implant bridges.
So like as little as 4 implants, you give them a full arch of teeth that are locked in there, don't come out?
Yes.
Is that right?
And that concept was a revolutionary concept that's developed over the past 20 years. 20 years ago, we didn't think that could be done. But now we know there's been multiple studies, tens of thousands of implants in these studies, extremely high success rates, higher success rates than what you see with even individual implants. Anywhere from 98.5% to 99% long-term success rate with these procedures.
But the upper dentures, right? There's like a suction, so they're fine.
Well, you would say that because do you wear a denture?
No.
Well, if you ask somebody that does wear a denture, I would venture to say, because I have talked to thousands of denture wearers, that most denture wearers, even though they do have some suction up on the top, would still prefer to not have to wear that denture. Because one, that denture still can become loose, and if it's in a situation where you don't want it to become loose, that's a problem. If you're at a big event, a party, a gathering, a reunion, it's also covering the roof of your mouth. It affects the way that food tastes. It's something that your tongue constantly has to play with. If you could eliminate it, most patients are going to say, yes, I want to eliminate this
So
denture.
same kind of thing, like 4 or 5 implants on the upper and they get teeth that don't come out?
Correct. We can do a variety of different procedures. Now for denture wearers, one problem with a denture is over time, the denture fits worse and worse because you start to lose bone. And for patients that have been long-term denture wearers, they have been told in many cases they don't have enough bone, they can't get implants. We can do very specialized implants that can still anchor these teeth into place to where you don't have to wear the denture anymore. It can all still be done in one day. There's no bone grafting needed, no long-term pre-workups that are having to be done, and it will get you out of the denture on the same day.
So no more dentures. Is that the future of dentistry?
I would say so.
Everything will be attached to implants?
There are,
whether it's 100 years from now, but is that the future?
You know, in the future they say we're going to regenerate teeth and you won't even need implants anymore.
Okay.
But I don't think that'll ever happen in our lifetime. But in terms of implants, there are very few patients that could not have permanent teeth with dental implants. Very, very few.
In one day. Now, how old can you be to do this?
The oldest patient we've had in our office is 94 years old.
94. They're not more likely to fall out
No,
if you're 94 years old?
No, the bone's still going to heal very well. And there's studies that have looked at age versus healing process for dental implants, and there's no detriment with age in dental implant healing.
Okay, now let's talk about this, because most dentists I talk to know who you are. You have a center, very unique, San Antonio, Austin, and other offices, but you do everything under one roof. That means that what takes other guys maybe 6 months, you do literally in one day. Tell me about that and why you're able to do it so quickly.
By having everything under one roof, we are able to work as a collaborative team. So we have the surgeons, we have the restorative dentist, we have the laboratory, and then all of our personnel, they've done thousands of these cases and they know everything that's needed for this. So in one day, we have the patient is having teeth that are digitally designed by our laboratory. They're having the surgeries performed with the best surgeons in the industry, board certified surgeons. We have the restorative dentists that are specialists, prosthodontists that are delivering the teeth that are designed by our laboratory personnel with the best equipment in the world. Zirconzon equipment comes from Italy.
I mean, you have your own lab. I mean, a real lab, like with 7 lab technicians.
And when we say we have our own lab, it's our lab just for us.
Okay.
We're not making teeth for other people. Other places that have a laboratory, they're still making teeth for, other offices from all over the place. Our lab is just for us. All of our technicians are just making teeth for our patients. And that allows us a lot of flexibility. We can do customization to give patients exactly what they want, because not everybody wants a perfect set of denture teeth. Not everybody wants a perfect set of bridge teeth. Some people want customized teeth. They want a little bit of crooked teeth. Some people want gaps in the teeth. Some people want very unusual things.
Do they get to see what it's going to look like when it's all done?
So with the digital smile design, with the Zirconzon Modelier software, we're able to take 3D face scans of the face. We then can digitally design the teeth and marry those images up with the face scans so we can see a preview of what the teeth will look like before anything is even fabricated. So that's very nice.
If everything works out, how soon could they eat after the procedure?
You can eat immediately. You can truly eat immediately after the procedure. We do want you to avoid certain things in the very, very beginning.
Take it easy a little bit at the beginning?
Yes, because one, your muscles are used to the old teeth that came out. And so we are putting new teeth in, and it feels a little strange to your muscles at first because some people, their mouths aren't used to having teeth. Their teeth have been gone for years.
Okay.
All of a sudden they have these new teeth in their mouth that their body says, hey, what are these? I can chew again. I need to figure this out.
So when they're all healed up, though, I mean, are there any restrictions on what they could eat? Can they bite a carrot with their front teeth?
You can eat a carrot. You can eat a steak. You can eat virtually anything that you can eat with your natural teeth. Now, we want you to avoid things we don't want you to eat with your natural teeth. We don't want you chewing on ice cubes. We don't want you biting through a jawbreaker. We want you.
Okay, that's fair.
Anything else is fair game. You can eat anything that you could eat with your natural teeth. So it's life-changing for a lot of people because now opens up foods for them they haven't eaten in years.
So just so I get this straight, I mean, if everything works out, they could actually do a consult. And this is the Denture Wearer. You get the imaging. They show up on a second appointment, walk in with no teeth, and walk out with fixed teeth, up or lower, that don't come out.
Correct.
Has that happened before?
Oh, yes. I mean, we've had patients that have come in, and within 24 hours, we had the surgery done and a permanent set of teeth attached. That's why it's many times referred to as a teeth in a day procedure. And you are truly getting a set of teeth in a day because they are permanent, they are
Good.
not coming out of the mouth. They do not snap in or out. They are there permanently, and the only way they come out is if we take them out for you. And so yes, we can do it in as little as 24 hours if necessary, and we've done that. And we have some patients that fly in from very far away to have these procedures done, and we are able to get that done very quickly for them because they're traveling great distances.
Okay.
And we can't certainly have them go back and forth a bunch of times because they're coming from so far away. So having all of that equipment under one roof, all of that personnel under one roof allows us to do this in a short period of time. Whereas if you're doing the traditional type of work, you'd have to go around and see a bunch of different dentists all over town. It'd be impossible to get it done in one day.
Now, what if you have gum disease, the bleeding gums, bad breath? If your gums are bad, can you still do this?
Yes, we hear that quite frequently where a patient will say, my dentist said that my gum disease is too advanced, I have too much bone loss, I can't get dental implants. Well, there's a difference between bone loss around teeth and bone loss for dental implants. Just because you've lost bone around your teeth doesn't mean that you still don't have enough bone for dental implants. So when we're doing our consultation with patients, we're really looking at the forest beyond the trees. So you may have a few spots where there's severe bone loss, but we're really looking at the bone beyond those teeth. And in many situations, in fact, most situations, we can find bone that we can use to where we can give you a new set of teeth in one day with dental implants.
Would you say it's common that patients were told elsewhere, you don't have enough bone to get dental implants, and you're able to do it? Like all the time?
All the time. And one of the reasons for that is most dental offices don't have CAT scan. And if they do need a CAT scan, they send you off to an imaging center. But most dental offices have regular x-rays, and you cannot see this level of detail for how thick the bone is, how much bone you have with a regular x-ray. So you have two scenarios. You have one where patients are told you don't have enough bone, you can't get anything done, and that's typically not the case because the CAT scan shows us you do have enough bone. And then we see the opposite situation where someone that doesn't do a lot of implants and has a regular x-ray says, oh yeah, we can do that, that's no problem. And then we look at the CAT scan and we say, well, wait a minute, your bone's actually quite a bit thinner and we could still do this procedure, but we're going to have to do some alternative techniques that's a bit more advanced than the typical dental office. And unless you had a CAT scan to evaluate that, you would never know.
But you've never had to turn anybody away, like say, there's nothing we could do.
In terms of bone, no. We have never had to turn any patient away because they had too little bone, because there are advanced techniques that not very many dentists around the country do. There, even board certified surgeons, a lot of them don't do these certain techniques. So for example, zygomatic implants. These are implants that actually utilize the cheekbone. Pterygoid implants. These are implants that go behind the sinus into a specialized bone that's very dense. Those bones are very strong. We utilize bone on the side of the nose that's also very dense. And they are more difficult procedures, but we do these procedures.
But difficult for you, but as far as the patients, they're IV sedated, they wake up with new teeth.
Well, no, not difficult for us, because we do these, we teach these. We teach these all over the world. I mean, for example,
so it's more technically demanding.
More technically demanded, definitely much more difficult for the typical implant dentist. But in terms of the patient, same exact level for the patient. They're asleep for the procedure.
They wake up with teeth.
They wake up with teeth.
Nice.
Our level, it's more of the planning ahead of time, because to do these procedures, we want to know ahead of time, hey, we're probably going to have to do this. And so that's where the planning comes in, with the CAT scan, with the bone level, the bone density. All of this, there's a saying, a lot of people don't know what they don't know. And some dentists that haven't done a lot of these procedures, that aren't utilizing a CAT scan for evaluating the patients ahead of time, they sometimes could get into situations where these more advanced implants are needed, and it causes problems because they didn't recognize that ahead of time.
Okay.
And
so no more dentures.
No more dentures.